Decisions matter, and if you can just decide, that's your strategy. Decide what you need to own, decide what you need access to, and then just commit to executing on that decision. I think there's just a lot of the paralysis by analysis and wait and see, let me figure it out. If things were right, I might do this, right? And it's just like, you got to build the future you want, not wait for it to be built for you. I think most leaderships are stuck in that analysis mode. They studied the market, they've seen the trends, and they just haven't committed to action.
Welcome, MedTech Gurus. Today we're joined by Mark Freitas, Managing Director and leader of the Life Sciences practice at Alvarez and Marsal. Mark advises MedTech companies, private equity firms, and strategic buyers on high-stakes M&A and operational transformation. His team's latest analysis projects that 2026 will mark a major shift in MedTech deal-making, with capital moving towards contract development and manufacturing organizations, sometimes known as CDMOs, instead of traditional device acquisitions. As device complexity increases and regulatory pressure intensifies, advanced manufacturing platforms are emerging as a strategic asset, not just vendors. Today, Mark will help us unpack what this means for founders, operators, and investors navigating the next wave of MedTech growth. Hey, Mark, are you ready to be our guru today?
Absolutely. Thanks for having me. Let's do it.
We're excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
I'll leave it to you to determine if it's fun or interesting. But I'm someone who's like a serial learner, still trying to figure out what I want to do when I grow up, right? So I started out as a microbiologist, decided I was too impatient for that, so then became a lawyer, tried a couple of different areas of law before determining it wasn't the area of law I didn't like, but maybe the profession itself. So moved into industry where I worked for a pharmaceutical company for a number of years, and then finally started a consulting firm, sold that, and now, years later, find myself at Alvarez Marsal. So I'm kind of this both a recovering scientist, recovering attorney, and still trying to figure it out.
Yeah, I love that. I've been a very similar journey in my life, and it's at the end of the day, all those little experiences really help add a lot of depth, though, don't they?
No, absolutely, and I would say it shows up in a lot of different ways, right? We always talk about like diversity of thought and how can that like help people kind of find new and interesting ways to kind of tackle complex challenges. And I find I draw on those experiences in unique ways, and it just helps bring those perspectives or unexpected, and so it's something that I try to keep an open mind about.
Yeah, absolutely. So, Mark, you're advising MedTech companies at a time where capital is really cautious, right? And complexity is rising. So, from a high level, what are most CEOs worried about right now?
Yeah, I think there's a number of things going on in the medtech space, and fundamentally, it's about managing that complexity and staying on top of and ahead of where the market's going, right? And so, in terms of building resiliency and managing that complexity, and like even as recent as last year, a lot of the conversation was just about when are we getting out of the trough? When's the market going to rebound? And that conversation has shifted towards the end of last year and into this year, where it's now much more of, are we doing the right things? Are we structured the right way to take advantage of the rebound that we're seeing? And so we see definite marked uptick in activity and interest in shaping and building capabilities that haven't been there in the most recent years.
Yeah, that's helpful. And, as I mentioned in the introduction, you've suggested and mentioned the outlook is that MedTech companies are shifting some of their M&A dollars to the CDMOs. So why is manufacturing suddenly becoming this strategic battleground? Do you have any insights for us there?
Yeah, I'd say the complexity of what's being manufactured today, it's fundamentally outgrown what most OEMs were built for 10 or 15 years ago. Right? And so because of this, what's actually winning in today's market, can't be made in yesterday's factories. And that requires a couple of different questions for organizations around where do I go get those capabilities? to what is truly core to my enterprise and what should I be building as my own capabilities. And so it's not a cost story, although that's certainly an important factor, but it's a capability story. And so as we think about hardware and software and services kind of converging inside a single device, that's a hard, kind of navigable way for companies to kind of find competitive advantages. And they got to take some of those capabilities across the different partners and ecosystems to be able to deliver on the promise to the market.
Is some of that quality driven, or are there other factors that are playing into that?
Yeah, I mean, some certainly is quality, but I think the other factors are, quality is kind of table stakes, and the other factors are, cost, right? There's certainly pricing pressures. Some of the geopolitical issues and tariffs and things like that also put pressure on like what does it mean to be competitive. And billing, that's part of the resiliency in the supply chain and in the devices itself, is something that is important to navigate because new technologies are coming every day almost, and that's changing the game of what does it mean to be competitive and what does it mean to be leading. And so being out in front requires like a constant evolution and continuous improvement on what your capabilities are and what your devices can do. And so we see this happening in a bunch of different ways, both on the OEM side of how to gain like competitive advantages and just small tweaks, right? That kind of allow the opportunities to either build some of that resiliency, take down some of that cost, or gain a technical advantage to their partners and CDMOs in particular of, well, do I navigate into like a particular specialized kind of capability and skill set that is highly complex? Where do I get that? How do I have quality and like strategic partners? To your point on the quality point, I can't necessarily hide behind my partners, right? So I got to have an ability to trust them and to trust their capabilities that become a kind of core component of what success looks like for OEMs. And so that's been definitely a growth factor in the past few years of just like finding those right strategic partners that have the depth and breadth that you're looking for. And within each area that you're operating in, that looks very different for the OEMs as they think about their partnership and ecosystem strategy.
Yeah, that's really helpful. It leads really into my next question is, historically the OEMs went out and they acquired devices, right? Some company, startup built something up to a certain level and then they acquired that. But by acquiring the manufacturing platforms, it's kind of changing that game. And I'm wondering, fundamentally, what changed in the economics there for MedTech? Do you have any insights for us?
Yeah, I think there's a couple of factors that kind of combine and converge, right? The first two that are kind of driving the bulk of it are that things that happen almost simultaneously. You had the interest rate starting to come down, that kind of creates capital for deal execution. And then you have a decade's worth of private equity investments into CDMO platforms that are aging out into the exit windows at the same time. And so you get a frozen deal market and you get a PE hold period that is basically ticking at the same time and kind of, as the alarms are going off, if you will. So now that credit is loosened and all that pent up activity is releasing at once, 2026 starts to feel different. And you converge that with the fact that there's a lot of what I call like medtechization of pharma, where you kind of get this like convergence between medtech and pharma as well. GLP-1s is a great example of that, where in the early days, now obviously there's pills, but in the early days, it wasn't just the drug itself, but the injector pen too, right? And like what is going to win in the market is that convergence of the device and the drug and using that as like a way. And we see more and more of the device being kind of a core ingredient to that. The other thing is we see is about supply chain onshoring. And that's driven a lot by geopolitics, but we see those moves happening in the market. And then, lastly, it'd be the one-stop consolidation play where I kind of talked about earlier about deep partnerships with CDMOs, OEMs are looking for those that have those like unique experiences. And I'd say Resonetics is a great live example where you look at what Carlisle and GTC are are doing there. So they have 3 acquisitions in Q1 alone, right? And so they just closed Resolution Medical about 2 weeks ago, and adding structural heart and neuromodulation to their portfolio. And so they're building this integrated platform that OEMs increasingly want to buy from instead of managing these like discrete capabilities. And so you see that opportunity kind of enter into the market. You see the capital kind of being loosened and the exit window happening. That's like this convergence of perfect storm, which then also enables OEMs to say, hey, should I actually monetize non-core parts of my portfolio and start to optimize my portfolio a little bit better to both free up cash because now, rates are going high, valuations are higher for those non-core assets. And that could be a way for them to either reinvest in core and buy some of these things that's coming out or, potentially grow into their innovations and their technologies a little bit differently. So that's putting more assets on the market and creating this like virtuous cycle in the market for 2026 that we see happening.
Yeah, that's interesting. And you touched on some of the complexity of some of these devices and how things are kind of merging and crossing boundaries, right? Like cardiac care, orthopedic, oncology, even wearables, right? And we've got all this stuff going on. So how does that complexity reshape M&A priorities, right, to kind of navigate through that? Can you help us out with some insights there?
Yeah, I mean, I think if you were to look back, even 5 years ago, you'd say, well, maybe 5 years ago is a little too soon, but maybe a little bit before COVID, it was by revenue, by customer lists, right? That was kind of a driver of the M&A priorities. And it kind of pivoted to this like specialized and technical capability and regulatory infrastructure. And so you get things like the structural heart, the neurovascular, the precision tolerances are measured in microns, right? And so you don't build that in 18 months, right? And so you look into other areas like regenerative and biomaterials, they're kind of creating new segments that have proprietary material science involved in it, right? And so these are not like commodity manufacturing capabilities. And so as you kind of look at like where can that go, the common thread across all of that and what's really kind of reshaping the priorities is scarcity, right? The capabilities are hard to replicate. They're hard to really kind of scale. And, understandably, as you kind of go into an OEM, as you're trying to make those decisions of, do I actually like need to build that specialized capability myself? If so, great. Like how do I do that? Where do I grab assets to accelerate that path? Or how do I build the competitive moat around it that I have developed? But if you're like, no, actually, like these are some really like difficult things, and actually accelerating the device to market means partnering with someone who's deep in those capabilities. And my IP is less in those, but more in the device and the way it's connected is a different positioning. And that's really something that's, kind of unique in the market now is the complexity is really driving a lot of the M&A priorities. And it's a lot driving like how you view your portfolio as well.
Yeah, that's interesting because and thank you for that. But as you're providing that answer, I was thinking, you're right. As back in the day, everything was done on cash flow, right? What's the cash flow look like? What's the prospects for growth? But I like the scarcity analogy, right? And I may put you on the spot here, but it seems like if you can find that unique combination of technologies, it might create this whole synergistic capability based on that core competency. Am I heading down the right path with that?
Yeah, no, absolutely. And I think the idea there is trying to make hard decisions now, right? And I think that the people in the market who are winning are the ones that are really making those hard decisions and taking, strategic bets, placing those bets and executing against them. I think the companies that are waiting for the market, are definitely, falling behind and definitely stuck into that, right? And it's kind of this idea, as you kind of say, well, what's the idea behind like ambition is really this thing that I'm going to take action in order to kind of drive to a particular outcome, right? As opposed to waiting for the market to react and tell you where to go, you're driving that. And so those who have that ambition are the ones that take agency over their organization and drive forward. And so we do see that as saying, hey, like the scarcity principle being kind of meaningful, their best advantage to benefit from that, right? Because the late followers or even fast followers to some extent are behind, in the time. So that sense of urgency combined with a sense of agency is actually creating a winning formula for medtech companies.
Yeah, yeah. Thank you for that. And you touched on the regulatory piece, right? In doing my research, you've highlighted regulatory capability as a value driver in some of the work that you've done. So a lot of our listeners out there are entrepreneurs or soon-to-be entrepreneurs. So how should these medtech leaders think about a regulatory infrastructure as the defensible moat that you mentioned? Can you provide us some insights with that one?
Yeah, perhaps I'm biased because when I was an attorney, I was a regulatory attorney. So maybe this is something to take with a grain of salt. But I'd go so far to say regulatory readiness is one of the more underappreciated value drivers in medtech M&A right now.
Mhm.
And what organizations are really thinking of it when they treat it as a compliance checkbox, it just is something that just isn't appreciated, isn't valued, and doesn't really provide the kind of competitive weight that it deserves. But it does create this like moat that you can navigate around. So it's not just having the certifications, it's the organizational muscle, right? Knowing how to run a 510K pathway efficiently, knowing how to manage post-market surveillance at scale, maintaining design history files that can kind of hold up under scrutiny. And those just seem like, okay, yeah, that's just table stakes, but it's not, right? Because it becomes super complex when we talk about taking agency, moving quick, like finding kind of where advantages exist, running those pathways efficiently, figuring out how to get through the regulatory hurdles, figuring out ways to build resiliency into your portfolio, leveraging kind of the regulatory frameworks are opportunities. So for a buyer acquiring a platform that has an infrastructure that's already functioning, it could save 2 to 3 years versus building it, right? And so when you kind of look at that, saying, okay, that savings has a real value. So why wouldn't you necessarily explore that? And for a seller, you might say, well, it separates top of the range kind of deal value from middle of the range, right? Because you kind of have like an off the shelf, like, ready to go opportunity that's audit ready. And it allows a premium, to the sale, right? If you're trying to kind of do that. So trying to kind of make sure those competitive advantages are clear. So regulatory readiness is really the difference between getting that premium versus getting a discount, right? And so trying to kind of understand and highlight and emphasize the value of that regulatory readiness is an important component to it, but it also is an important component to think of from a buying strategy. How quickly can it advance what you're trying to do?
Yeah, that's really helpful. Right? And I was just thinking about, that intersection of biopharma and device, right? Because having that experience, especially in that segment, I would think would be critical because are we talking about a pharmaceutical? Are we talking about a device? Where are we at here and how do we move forward?
Yeah, and I think even in that, concept, uh, it's chicken and egg, right? Are we waiting
Hmm.
for the pharma,
Yeah.
to get through their regulatory hurdles, or waiting for the vice to clear their regulatory hurdles? And the combination together, the more streamlined as a med tech operation, the more streamlined your regulatory hurdles are. It also gives you an advantage to be the partner of choice as you're kind of working with these pharma organizations as whether it's being a drug delivery mechanism or some type of like companion device or whatever the nature and form that combination can take. It does matter, right? Because if you're the drag on the pathway in the partnership, then that detracts value, right? And so it's important to understand your equation in that combination as well to be able to kind of again get a premium in the partnership deal structure, but also be, more selective in terms of who you partner with too, right? Because you also want to make sure that they're not dragging you down and slowing you down. And so it's important to understand from a partnership diligence standpoint, what's the regulatory readiness of the partners, and how effective is it to efficiently get to market and help the patients who need the devices.
Yeah, that's really helpful. And Mark, let's talk a little bit about timing too, right? So for our gurus out there listening in, when does it make some sense to think about this vertical integration on manufacturing, and at what phase should they strategically align with a CDMO?
I mean, I would say realistically, it depends the way you are in your life cycle, but still, most people get the timing wrong, unfortunately. I'd say for pre-commercial and early commercial, partner with a CDMO almost every time, right? It's something where you're trying to manage your cash, and your burn rate should be going towards R&D, clinical evidence, and the regulatory clearance, right? Building a manufacturing facility at that stage is just, most often a capital allocation mistake. Again, if there's something truly innovative and differentiated that is the heart of what you're doing, sure, that's the core business. Still, there should be ways you could break it up, modularize it, and find a way to kind of have components made elsewhere to free your cash for the things that matter. The inflection point comes when your device complexity becomes your competitive moat, right? So understanding that, is important. So I don't want to discount that scenario. But if the way you make it is inseparable from what makes it better, that's when owning manufacturing starts to make sense, right? So again, it's hard anecdotally to be able to kind of separate and distinguish those things. But the test, I would say, is, does your manufacturing process create IP, or does it, consume IP and consume capital? And so if it creates IP, then own it. If it consumes capital, then partner it, right? It's kind of the simplistic way to think about it.
Mm-hmm.
One thing I would say founders underestimate is that modern CDMOs aren't just contract manufacturers anymore, right? And so it just seems like order takers, and you just task them with something. They actually do bring that regulatory infrastructure, their design support, the scale up expertise, right? So for a startup, partnering with the right CDMO is like buying 3 years of capability overnight. And so put diligence into those things too. It's trying to think of it as like, who's the accelerant that's gonna like be the fuel I need to kind of power this thing faster, get your great ideas to the patients who need them faster, right? And be able to, kind of do this in a meaningful way that preserves the capital to the things that'll move your business forward best, right? And so that's the I'd say the one component is you try to think about when to partner, what's the timing, particularly in the early stages. It's really just trying to separate, like, do you create IP or do you consume capital? And as you kind of relate those choices, that can help guide you as to the right partnering strategy.
Yeah, that's so spot on. Over the years, we've had a couple of CDMOs on MedTech Gurus, and I was always fascinated by the engineering capability that a lot of those organizations have, right? That can look at a project and go, "Hey, we can help here," or "Have you ever thought about this approach from your design to help with that scalability?" So you're spot on in terms of engaging with them early.
Yeah, and I think it's great to think through, like, it's the what got you here won't get you there kind of
Yeah.
philosophy too, right? But it's hey, like, I had a recent conversation. Hey, this is how like I built the company, my first company I sold. I was like, great, but like the market's changed, right? So it's
Yeah.
like you can do it differently, you can do it faster, and just being a serial learner is important. As a founder, just to understand, or just even as any OEM, but just understand what's happening in the market, what's a better way that I could achieve the ultimate aim, and rather than build things the way they've always been done, trying to think about, well, what could you do differently, and what are some other people doing that maybe could inspire you to take a chance and try something different. But the CDMO component of like, oh, they're just thinking of them and putting them in a box isn't fair, because they've come a long way since 10
Mhm.
years ago.
Yeah, for sure. So, Mark, we talked a little bit earlier about the market might be entering a valuation re-rating window, right? As we record this in 2026. Should buyers and sponsors act now before competition intensifies, or should they keep their powder dry for a little while longer? What are your thoughts?
Yeah. So yes, act now. So I say that quickly just to make and emphasize the point. I think how you act is different though, right? Depending on like what side of the table you're on and what assets you have. But the re-rating in 2026 already underway. So we entered 2026 with roughly twice the deal of activity we had entering 2025. And 2025 was a growth year off the trough of the prior years, right? So we're already seeing kind of a massive uptake in activity. And I think Teleflex's sale of its medical OEM in December is a transaction that everyone's watching, right? So it's going to set the benchmark for how market prices and specialized manufacturing platforms get set going forward. And, it should close in July. So you can't wait for that, right? But people are watching that and understanding, okay, we get what the valuations there are. It looks like it's going to close, right? But other deals are happening, right, off of that, and you're starting to see the valuations kind of pick up. And so what that means is if you're selling an asset, the valuations you might want to wait, right? Because you're going to see that the valuation's going up. But, depending on the circumstance, you wait too long and there's too many assets and how do you separate? And you might have missed your window, right? So timing's important. But no, the market is buying. If you're buying assets, you want to buy quickly, right? Before the values go up too high. And so we're seeing some really smart people who are moving quickly to pounce on assets that they've been eyeing for a while and really kind of find assets that fill capability gaps that they're looking to do. So, the challenge is that once the benchmark deals finally close and, some of these other triggers kind of formulate, there's the market starts to recalibrate. Great, yeah. But the entry price for that same asset goes up over time. And so that's why timing matters, right? So if you're buying or selling, there's this dance that's going on right now that will continue to go on. So it's an aspect of knowing where you're at on the table. But regardless, there's pre-work that's required for any of those things to happen, right? If you want to sell an asset, well, you gotta prepare for that, right? You got to make sure, as you said, like everything is kind of set up. You got clean documentation. Your financials are easy to separate. You have a strong regulatory infrastructure that's like are easily to carve out, and it's ready for sale, and that takes months, right? So if you haven't started, go, right? Get going, right? And try to figure out. You may decide not to sell, but at least if you do pull the trigger, you can, as opposed to missing the window and wishing you had done that ahead of time. And similarly, if you want to buy something, you may be sitting on a pile of cash and that's easy and fine. But most, have to, do some financial engineering to prepare for that and to start to understand like the implications of what would buying an asset do from an integration and a management standpoint. Those aren't like seamless transactions. And so you got to prepare your organization for that, right? And so both require a bit of preparatory work that should be underway now, even if you choose not to do a transaction. It's important to be ready for one if the market presents a great opportunity for you.
Yeah, that's great advice. In thinking about it now, do you expect as we move forward some additional like roll ups, carve outs, or other exits to dominate our next steps?
Yeah, so I think all three are happening right now simultaneously, right? So they're kind of feeding off of each other. And that's kind of what makes this cycle a bit unusual, So we have exits from mature platforms, like I talked about. So the 2019, the 2021 vintage, is hitting their hold period maturity, and so those assets are coming out. And then the roll-up activity is happening. We talked about the Resonetics as an example, but a lot of platforms are still in build mode, right? And so right? If I can add more capabilities, start to kind of drive that. So we do see that happening. And then the carve outs from OEMs who've decided again, monetize some of the non-core parts of their portfolio, Teleflex being the marquee example in the market right now. But we see that happening as well. So the dynamic that people miss, though, is that PE exits create acquisition opportunities for OEMs, and OEM carve-outs create acquisition opportunities for PE, right? So it's a self-reinforcing cycle that we're seeing take place right now. And so the real matter for them is, when you think about a differentiator on exit, to build the platform, to really, I would say, be itself an actual platform, or do you just have a collection of parts, right? And that integrated capability is really what's separating kind of the winners from just the also rans, if you will, in the market. So integrated capabilities, diversified customer relationships, regulatory infrastructure, like those things matter. That's like operating at scale and showing a mature business. And that still matters. So it's not just that these things are happening. They could still be bolt-ons or tuck-ins and small little capability plays. But the big moves and the big, like, kind of, I would say, the banner deals that everyone kind of like focuses on, of like, how do they get such a high premium? It's usually the answer is they're a little bit more robust and a little bit more mature than like a single capability might be. So that's something that's commanding a premium, and we're watching very closely.
Yeah, that makes total sense. And so, Mark, if you're advising a MedTech CEO preparing for growth or an exit over the next 3 to 5 years, if there is such a thing, what is the single most important manufacturing or M&A strategy should they be thinking about right now?
Decide. Just one word.
Uh-huh.
It even if it's an old Rush song, right? Even if you choose not to decide, you still have made a choice, right?
Yeah,
So
right.
the idea behind it is decisions matter, and if you can just decide, that's your strategy, right?
Mhm.
And so decide what you need to own, decide what you need access to, and then just commit to executing on that decision. I think there's just a lot of the, paralysis by analysis and wait and see. Let me figure it out. If things were right, I might do this, right? And it's just like you got to build the future you want, not wait for it to be built for you, right? So I think most leaderships are stuck in that analysis mode. They studied the market, they've seen the trends, and they just haven't committed to action. And so aligning your manufacturing strategy with your product roadmaps, not your current product line but your roadmap, right? Where you're going in 3 to 5 years matters. And so does your manufacturing footprint support that, right? Or does it drag it, and slow it down? And whether you're buying or selling, again, the preparation is important, and it really is what makes the transaction happen. And so the operational work you do in the next 12 months determines where you transact. And so that point of like, are you leaving something on the table or are you taking advantage of it? Again, doesn't necessarily even need the decision to pull the trigger, but you need to decide that you're going to be ready for it if the opportunity does present itself, right? And that's the point of like, luck is when opportunity meets preparation, right? And so, okay, I'm telling you the opportunities are there, but it's up for you to be prepared.
Yeah, I like that decide part, right? Because to me, that would make sense. And I'm thinking about the regulatory piece, the IP piece, all this kind of stuff. Organizing that early, right, when it's still kind of an easy task as you build, rather than at the last minute where you're trying to scramble and put everything together to get it ready. Is that heading down the right path?
Yeah, absolutely. And I think it's just moving forward, right? Every day better than the last, and it's different than, like, you can run fast, but it doesn't mean you're running in the right direction, right?
Yeah.
So it's important to kind of set that direction and have movement towards that. It's more important to be moving in the right direction than to moving fast. But everything we talked about, like, speed matters too. But what enables speed is decisions, right? Just knowing, okay, like, this is what we're doing, let's go, right? And then if I can course correct and pivot and fail fast, all those kind of vernaculars that are kind of used, as kind of colloquial staging of, oh, let's, like, how are we innovative, adaptive, agile? But really all it just means is like, okay, like what do we know today that we didn't know yesterday? And how does that impact what we're going to do? And as long as you're putting a stake in the ground and moving towards it, you're better off than kind of waiting.
Yeah, yeah, I love that. So, Mark, this sounds like a really exciting time for you and your team. Where are you going from here? What does the future hold?
If you look at my past, the future
Mhm.
is completely uncertain, right? So who knows what I want to do, right? But like at Alvarez and Marsal, we kind of do a lot around helping companies navigate these types of questions, right? So we're purpose built for these moments, and it's something where we help leadership teams kind of work through those decisions, right? And how to navigate forward and actually execute on them. And that's a different thing from just like developing the strategy, but actually executing it. And so it's an exciting time for the industry. It's an exciting time for patients who are looking for innovative devices to help them. And it's an exciting time for investors who are making investments in the space, right? Because there's markers of who's positioning to win, who's actually going to generate like good return on invested capital, who's actually going to innovate in the space and drive new era for healthier patients going forward. And so that part, it's great to be a part of that and to help kind of leadership teams kind of work through that. And whether it's through work or through friendships or just as a consumer as well. It's just something that I'm excited for the future of the MedTech space, and any part I get to play in it, brings me joy.
Yeah, that's fantastic. So, Mark, first of all, I'd like to acknowledge and thank you for the time you took to be our guru and all the insights that you provided us today. If our gurus out there want to learn more about you or Alvarez and Marsal, how do we do that? Is there a website or in LinkedIn? How do we learn more?
Yeah, so certainly you can, find me on LinkedIn. It's something I'm happy to anyone interested in the conversation, pick it up and keep having the conversation. And we certainly have a website as well, is alvarezandmarsal.com. You can kind of go check us out. We're a global firm across many industries, but there's life sciences industry is the one that we focus on, MedTech and pharma for. So you can find all of our experts around the globe who can kind of cater to specific questions that anyone has. But, always happy to continue the dialogue and continue to offer, any insights that can be helpful to others.
Oh, that's fantastic. So, Mark, once again, thank you so much. It was a great discussion. I learned a lot. So we appreciate your time and insights as our guru today.
Well, thanks for having me, Tom. I really appreciate the opportunity to share what I can. So.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.